Welcome again. This is Jason Renault with the Alternative Mobile Services Association. And today I'm with Marvin Swartz, who is physician associated with Duke University. Welcome, Dr. Swartz.
Yeah, thanks very much for having me. As you say, I'm Marvin Swartz. I'm a psychiatrist at Duke and have been working in a variety of settings as a clinical psychiatrist since 1981. And one of my interests is in how people with behavioral health conditions fare not only in emergency services, but in their interactions with the law, in ways we can improve the system so that people with behavioral health conditions who interact with the law, either in the civil or the criminal setting, fare better and are treated in a less traumatic and disadvantaged way. And so our interest in this area. So I'm also affiliated with a center at Duke Law School called the Wilson Center for Science and Justice. And one of the things we've been working on there is to look at how people are transported during involuntary commitment and that whole system of transportation. Because one, we asked the question, do people need to be transported by law enforcement under involuntary commitment? Are we overusing that option, and why? And as you know, we've had a series of publications that try to shed some light on that. One is a publication in Psychiatric Services, a psychiatric journal, that looks at state laws about transporting people under involuntary commitment. And there is an urban legend that says that, well, if people are under involuntary commitment, they have to be transported by law enforcement.
Yeah, that's a commonly understood action.
Yes, and it's in our study where we went state by state and looked at their statutes on involuntary commitment. It's absolutely not true. It's a practice, and it's evolved so that people think that it should happen, and in many ways prefer that because it's seen as a free good to the mental health system because they don't have to pay for it.
Right.
But it's not as if no one pays for it. It's just in the budget of public safety. So when we looked at these states, and we looked at all the states in the District of Columbia, it's absolutely untrue that state laws require that law enforcement transport. The states give great flexibility. In fact, I think there's just a handful of states that specify law enforcement. But in the other states, by and large, local communities have the option to design their system of transporting people under involuntary commitment. The reason that this is all so salient is we found that people are often transported in order to gain secure transport. Because people are so risk averse, they put people under involuntary commitment so law enforcement will transport them.
So these are the hospitals that are risk adverse.
Yes.
Okay.
Yes, the hospitals want to make sure that they are increasingly risk averse, and instead of being patient centered and thinking what will be the most comfortable and therapeutic way to transport the person, they're thinking about their own position and not wanting to be sued for something going awry. And so they put a person under involuntary commitment and then frequently release them when they get there. So we overuse the involuntary commitment mechanism as a way to transport people for free.
And of course, the police departments are impossible to sue.
Yes. And they don't want to do it.
Oh,
Uh,
I can imagine.
it's very time consuming, as you know, because um, particularly in rural areas, they have to transport the patient and sit with the patient while the evaluations happen. And that can be very, very time consuming. Say you take a patient to a hospital for their typically their second exam, because most states have a 2 exam system. Well, that second exam can take a long time because there's a bunch of people queued up. And so by the time an exam that typically lasts an hour happens, the um, deputy may have spent a day there.
Well, help us understand, and you know the answer to this, but why does the deputy need to stay? I mean, they just took them to the hospital. They could just hand them over to the hospital staff. Why do they need to stay until that person is admitted?
Well, they usually by statute, they have to return the person to where they were picked up if the person isn't committed. But that's not the most, I think, common reason. The most common reason is that um, the hospital may not have a security uh, office itself. So in big urban hospitals, typically there's, hospital police who will accept custody, although they don't have to, but
Hmm.
usually they'll take over custody of the patient. But in rural hospitals or hospitals that just don't have their own security system, then the deputy has to stay.
So if the deputy doesn't stay, that person can say, just leave.
Right.
I see. I see.
But either way, they have to go back and transport the person if the person's released.
I see. So you in your initial article list an fascinating statistic about the amount of time, amount of budget that this transportation takes from law enforcement.
Correct. And I think the estimate, this was done by the Treatment Advocacy Center. They polled uh, law enforcement departments, and the overall estimate was about 17% of their budget was consumed by transport under involuntary commitment. And that's a low estimate if you think about it, because they're involved in a lot of crisis response situations uh, that are not part of that statistic. We're just talking about transport there.
That's hundreds of millions of dollars a year
Correct.
in police time and budget, city
Correct.
budgets. That is,
And that report and other reports, indicate that law enforcement don't feel like they have the training and the expertise to do this. And the police and law enforcement are involved in so many different types of law enforcement activities that it's overwhelming. And this does not require a police response or law enforcement response. And I'm sure, as you know, we're developing a lot of alternative um, crisis response mechanisms that only use a law enforcement response when it's required. So they'll typically in those situations, non-law enforcement trained people will go to the scene and they'll only call in law enforcement when there's essentially a threat of violence.
now, North Carolina is really a hotbed of this alternative response, mobile crisis work. Do you have some recommendations about alternatives to police here? What would that look like for transportation?
Yeah, so they, you have to triage. So someone, on a 911 or a 988 line has to do their best to query the caller about potential for violence. And then there's different configurations. You can have a purely behavioral health response, so send out clinically trained people if there's a very low risk for violence. If there's a concern, you can have a co-response approach where there's a team of law enforcement and behavioral health clinicians initially going to the scene or doing the transport. Or you can have a pure law enforcement response. But in the, we think that in the overwhelming number of cases, law enforcement is not required as a crisis response. And it's just taking away from, other forms of law enforcement.
So, the day that one is civilly committed is often one of the worst days of their lives. What is the impact of having law enforcement do this work in the prospective engagement of a person in the psychiatric system?
Well, I had it summed up really well, I thought, by a sheriff who we were interviewing, because he said, if you call us, you're going to get a law enforcement response. Call law enforcement, you'll get a law enforcement response. And he just was being factual. He said what his folks are trained to do is to act as law enforcement officers. And that means that if they go to a scene and someone needs to be transported because there's a custody order or because they determine that the person needs a psychiatric evaluation, the person's going to be put in a police car or a sheriff's car. They typically have discretion, but frequently they use handcuffs to place the person in the car, and the person rides in handcuffs. And there's very little attempt to either match the gender of the officer to the person in crisis. And often, and we've interviewed people who've said this, patients who've said, I couldn't tell whether I was arrested or taken, under civil commitment. They had trouble distinguishing the two because it felt identical.
Did you find in talking to folks that there's some degree of shame or personal affrontage that having to be in a police car?
Oh yeah,
having a medical
I mean,
event?
It's been very traumatic, and there's one true incident that happened not too long ago that's been talked about quite a bit, and this was a young woman. She was in her mid-teens, I think, and she was feeling suicidal, and she asked her parents to take her to the emergency room. So it was her voluntary request. And she was evaluated, and the person evaluating her determined that she needed to be hospitalized for her suicidal behavior voluntarily. She wanted to go. She was scared that she would hurt herself. And there were no beds in that hospital, and so the young woman had to be transported to another hospital. To effect that, they put her under involuntary commitment without discussing it with their parents. The parents were there because they had taken her to the emergency room. And so she was placed under involuntary commitment, picked up by law enforcement, put in handcuffs, and transported to a hospital 3 hours away without the consent or involvement with the family, who would have been happy to transport them themselves, and the law permitted that. The law clearly said that if the parents or someone has the wherewithal to transport someone under that situation, it can be permitted. But the provider in the emergency room never considered that option. And this was just tremendously traumatic to this young woman and to the family who were not part of that process.
And that mom is going to think twice about calling 911 in the future,
Yeah, absolutely.
which could really be result in a tragic outcome for that young woman.
Yes, yes.
Why is this not the work of ambulances? Why aren't ambulances able to do this?
That's a great question. I think um, one part of it is stigma that me mentally ill people are considered to be different and need a different treatment. And then I think another large part of it is that as involuntary commitment law has drifted towards um, dangerousness. So, in the 60s, when we rewrote involuntary commitment laws, the civil liberties folks moved us to saying we should only confine people who are dangerous. You can only take the rights of people away if they're dangerous. And so that created this common belief that people who needed to be committed were universally dangerous. So that function was handed over to police, that these were people who were too dangerous to be transported in other ways, and so we'll use law enforcement to do it. There was also the convenience of this was a free good to the mental health system.
I had not thought about that before, but that's really intriguing that because the police don't have the capacity in some way to say, no, we're not going to do this, that the hospital, the ambulance make by refusing to provide these services almost require the police to provide this service.
Absolutely.
And do you see any pushback from law enforcement? You've heard some resentment.
Yes, yes. So as this issue's been discussed more and there's more focus on alternative alternative crisis response, law enforcement have really pushed back and said, one, we're not trained to do this. We have so many other responsibilities. We're not going to do it indefinitely. Now, one of the issues is if the money's in their budget to do the transport,
Right.
are they going to be willing to give up those positions, A, and B, can you move those dollars from public safety to mental health?
To public health. Yeah, that's a big gap between those two ideas.
And in a perfect world, you would have duplicate funding for a while to affect that transition, or let public safety keep the funding to reinvest in other areas. But budgets are strapped, and there's not a lot of slack to double fund things.
Well, Dr. Swartz, thank you so much for your work. We'll link to both of these articles in both the newsletter below and in the YouTube video. Thank you for talking to me.
Thanks for having me, and thanks for your interest in this topic.